Most men who come into my office with advanced prostate cancer tell me the exact same thing. They sit in the chair, look me in the eyes with that look of confusion and fear, and say, "Doctor, but I don't even have trouble urinating. How is this possible?" It is exactly at that moment of denial that the battle is often lost before it even begins. You have been trained to believe in a myth. You assume that when prostate cancer arrives, it sends a clear warning. You think it will hurt down there. You believe you will see blood every time you go to the bathroom. But the medical reality is much more cruel and silent. Most of the time, the most dangerous sign, the one that separates life from death, appears in a place you would never suspect. You feel a pain. Take a simple anti-inflammatory. Assume it was the way you slept or the weight you lifted, and go back to bed. Meanwhile, the tumor silently spreads to your bones. I am Dr. Richard Powell. If you are over 60, or if you love someone who is, I need you to eliminate all distractions now. In the next few minutes, we are going to have a frank, man-to-man conversation. I will show you the 3 signs your body might be giving you right now that you are ignoring out of stubbornness or lack of knowledge. The first sign is confusing. Many mistake it for simple old age. The third is a taboo, something men are ashamed to tell even their wives. But the second sign is silent and treacherous. If you feel it, we need to run. Let's get to work. We will start by diffusing a bomb inside your head. I call this the old man's trap. You know what I'm talking about. It's that mindset that as we age, certain things break, and that's just normal. If your knee cracks, it's age. If your vision worsens, it's age. If you start getting up 2 or 3 times a night to use the bathroom, you tell yourself it's just age. Listen carefully to what I am about to say. The prostate is not just any organ. For male health, it functions almost like a second heart of your vitality. It sits there, hidden, protecting the bladder, controlling the flow, and assisting in your sexual function. When it starts to fail, it is not just aging. It is screaming for help. I recently saw a patient. Let's call him Robert. He was a strong, 65-year-old businessman, accustomed to being in command. He came to see me not because of his prostate, but because his wife insisted. He sat across from me, arms crossed in that defensive posture I know so well, and said, "Doctor, I'm great. I only get up about 4 times a night to urinate, but my father did that, and my grandfather did that. It's a man thing." I looked at him and said, "Robert, getting up 4 times a night is not a man thing. It is your body's cry for help. There is a huge difference between normal aging and a pathological warning. Early-stage prostate cancer rarely causes symptoms, that is true. But when it starts growing, or when it coexists with benign growth, it alters the architecture of your internal plumbing system. Ignoring this out of pride or fear of receiving bad news is what turns a treatable problem into an irrevocable sentence. We men have a design flaw. We think we are invincible until the moment we can no longer get out of bed. The reason I am recording this is so that you don't have to reach that point. I want you to understand your body as a precision machine. When the oil light comes on in your car's dashboard, you don't stick black tape over it and keep driving. You stop. You investigate. So why do you do this to your own body? This brings us to the first area we need to explore. Sign number 1. I call this the bathroom detective. But be careful. It is not what you think. Everyone talks about going to the bathroom too often, frequency. But cancer and serious prostate problems have a more subtle signature than just how many times you go. The secret lies in the hesitation. I want you to visualize the scene. You feel the urge. You go to the bathroom. You position yourself. And then, nothing happens. You wait. 1 second, 5 seconds, 10 seconds. You have to strain, contract your abdomen, and force your pelvic muscles for the stream to begin. When it does start, it is not that strong, parabolic jet you had when you were 30. It is a weak flow that drops close to your feet. Sometimes it stops and restarts. That initial hesitation is critical. What is happening inside is pure mechanics. The prostate wraps around the urethra, the tube that carries urine out, like a ring tightening around a finger. If that ring tightens too much, the bladder has to work twice as hard to push the liquid through. Over time, the bladder tires. It loses its strength. Here is the detail you need to make a mental note of: the feeling of incomplete emptying. You know that feeling when you finish, zip up, wash your hands, and before you even leave the bathroom, you feel like there's still something in there? That heavy, uncomfortable sensation that the job wasn't finished. That is dangerous. It means urine is being retained. Stagnant urine is an invitation to infections and stones, and a clear sign of obstruction. Now, you might be thinking, "Doctor, isn't that just the benign enlargement all older men get? Benign prostatic hyperplasia?" It could be. But here is how we differentiate the real danger: the speed of change. Benign hyperplasia, the natural growth, happens over years. It's like watching a tree grow. You barely notice the change year to year. Cancer, or an aggressive malignant obstruction, tends to change the scenario faster. If you were urinating well 6 months ago, and suddenly, in a matter of weeks, your flow has stalled, you developed urgency, and you have to rush to the bathroom or risk leakage, that is not aging. That is a blinking red alert on the dashboard. The speed at which your symptoms worsen is just as important as the symptoms themselves. If the change is rapid, do not wait. Now, we move into darker territory. I want to discuss the second sign. This is the main reason why so many men lose their lives to this disease. If you forget everything else I say today, remember this. The second sign is a silent killer because it is disguised. It appears as displaced pain. Imagine you start feeling a dull, deep ache in your lower back, right at the base of your spine, near your hips, or maybe a pain in your ribs, or a deep stiffness in your pelvis, in the bones you sit on. What does the average man do? He rationalizes. He thinks, "I helped move furniture yesterday." Or, "Maybe the mattress is old." Or, "It's just my old arthritis flaring up with the change in the weather." You take a painkiller. The pain eases a little, but it doesn't go away. It stays there. A constant, dull, deep presence. Why is this a sign of prostate cancer? Pay close attention to the anatomy. The system of veins that drains blood from your prostate, the prostatic venous plexus, has a direct, valveless communication with the veins surrounding your spinal column. It is like a direct highway from your prostate to your bones. When prostate cancer decides to leave the capsule, when it decides to spread or metastasize, the first place it loves to visit is the bones, the lumbar spine, the pelvis, the ribs, the femur. This pain is not muscle pain. Muscle pain improves with rest. If you strained a back muscle, you lie down, rest for 2 days, and you get better. The pain from bone cancer, the metastatic pain, is different. It often worsens at night. It wakes you up. It does not respond well to rest. It is a pain that seems to come from inside the bone, as if it is being gnawed away. I am not telling you this to scare you without cause. Not all back pain is cancer. The vast majority, 99%, is muscular or joint-related. However, if you are a man over 60 who has never had serious back problems, and you suddenly develop a persistent pain in your lower back or hips, a pain that does not go away after 2 weeks, does not improve with basic physical therapy, and is accompanied by inexplicable fatigue, stop treating it like arthritis. I have seen men treat sciatica for 6 months with massages and chiropractic care, while the tumor grew in their prostate and ate away at their vertebrae. By the time they reached me, the disease was already widespread. If the pain is persistent, deep, and non-mechanical, your doctor needs to know. A simple blood test and an MRI can differentiate a slipped disc from a metastatic lesion in a matter of hours. Do not gamble when the symptom is unexplained bone pain. Prostate cancer loves to hide behind the mask of a bad back. Do not let it fool you. This leads us to the third sign. Here, we need to lower our voices and talk about the bedroom taboo. It is what no one discusses at the Sunday barbecue. It is what you do not tell your friends at the bar. But in the silence of your room or in the shower, you know something is wrong. The prostate is vital for sexual function. It produces most of the fluid that transports sperm. When a tumor is growing there, it invades tissues, presses on nerves, and ruptures small blood vessels. Sign number 3 is painful or visible dysfunction. Specifically, I am talking about pain during ejaculation or blood in the semen. The medical term is hematospermia. Imagine the shock. You are in an intimate moment, and suddenly, you notice blood. Not in the urine, but in the seminal fluid. The color can be bright red, or more commonly, a brownish color, like coffee grounds, indicating old blood. Most men panic absolutely at this moment, but panic paralyzes. What do? They hide. The shame of admitting something is wrong down there causes them to avoid the doctor. They even avoid their wives. They stop having relations so they do not have to face the problem. In addition to blood, there is pain. The sexual act should be pleasurable. If you feel pain, burning, or deep discomfort in the pelvic region during or immediately after ejaculation, that is not normal. This indicates inflammation, infection, or, in more serious cases, the presence of a tumor pressing on sensitive structures. And there is yet another aspect of this sign: sudden erectile dysfunction. ED. Look, it is normal for erections to lose some rigidity with age. But if you had a reasonable sexual function, and suddenly, in a matter of a few months, you completely lost the ability to have or maintain an erection, this may not be just psychological or age. The nerves that control erection pass very close to the prostate's surface. A tumor that grows outside the gland can affect those nerves. The sudden onset of impotence, especially if accompanied by any urinary changes, must be investigated. Do not just chase after the blue pill. Viagra can mask the symptom, but it does not cure the cause. If the car engine is failing, you do not just put in better gasoline. You open the hood to see what is broken. Sudden erectile dysfunction is your body saying there is a vascular or nervous problem, and the prostate is the #1 suspect. So now we have the complete picture: urinary hesitation and the feeling of a full bladder, silent and persistent pain in the back or hips, and visible or painful signs in your sexual function. If you identified with any of these, fear must be knocking on your door right now. Fear is useful if it makes you act. But paralyzing fear is your enemy. Many men prefer not to know. They think, if I go to the doctor, he will find something. So if I don't go, I don't have anything. This logic works for a child who covers his eyes to avoid seeing the monster, but it does not work for the biology of cancer. I want to offer you the survival protocol, and it starts with you losing your fear of the finger. I know. The joke is old, the embarrassment is real, but let's weigh the options. The digital rectal exam, DRE, lasts on average 10 seconds. 10 seconds of mild discomfort and minor embarrassment. In exchange for those 10 seconds, you gain the chance to see your grandchildren graduate. You gain 10 or 20 more years of life beside your wife. Do you really think your masculine dignity is so fragile that it cannot endure 10 seconds of a medical exam? The good news is that today we do not rely only on the DRE. Medicine has advanced spectacularly. We look at the velocity of PSA in your blood, not just the total number, but how quickly it rises. We have multi-parametric magnetic resonance imaging, MPMRI, an incredible technology that allows us to look inside the prostate with absolute clarity, often avoiding unnecessary biopsies. A prostate cancer diagnosis is no longer a death sentence, nor is it a sentence of impotence or incontinence, if caught early. When we catch it early, we have robotic surgeries with millimeter precision. We have focal therapies that destroy only the tumor and preserve the rest. But I can only help you if you step through my office door. So, my friend, here is your homework. Observe tonight. Observe how you urinate. Observe if that back pain has been there too long. Observe your intimacy. Be honest with yourself. Do not be the man who waits for blood in the urine or a bone fracture to ask for help. Be the man who acts. Be the man who takes care of himself, not out of vanity, but because your life is the pillar that supports your family. Do not let pride shorten your story. Protect your potency. Protect your life. If something feels wrong, seek a urologist this week. I am Dr. Richard Powell, and I hope I never have to give you bad news that could have been avoided. Until next time.